Good morning, Miss Jones. My name is Laura Hofstetter, and I will be completing your exam. Here is my ID for verification purposes. Thank you for answering all those questions today. We'll be completing your exam head to toe. At this time, we're going to start with vital signs. And those all look wonderful. Since you have asthma, we'll use the spirometer. Blow into the spirometer. That shows that her pulmonary function is good. And then we're just going to assess. I know you've answered many questions, but we're going to just assess some orientation. What is your name and date of birth? What building are you in now? What is the date and year? Thank you for answering those. Now we're to start. I'm just going to start by palpating her head and neck. And at this time, we don't need to inspect specifically the skin, as we'll be doing that as we go and looking at her hair at the same time. Those things can all be done simultaneously. We're going to also palpate her cervical lymph nodes, looking for any masses or lumps. Much of her facial symmetry and cranial nerve involvement we've been able to assess throughout our interview process, and noticed facial movement was all symmetrical. Making sure to palpate all the neck lymph nodes as well. And supraclavicular. We're going to do a visual acuity test with her glasses on, since she has corrective lenses now. Having her read the line with both eyes. For the essence of time, you would then cover the right and left eye and measure those and document those. We also want to document her peripheral vision. Tell me when you can no longer see my fingers. We identify good peripheral vision. Additionally, we want to monitor her eye movement. This is again a test for cranial nerves. Follow my finger with just your eyes. And then also looking for convergence of those eyes. All good eye movement. Then we're going to take off her glasses and assess reactivity of her pupils. And so we can document that those are perla. Again, we're going to use the ophthalmoscope. She's had an eye exam recently, but still for our purposes, we're going to be looking at the eye health. We see red reflex there, and then looking into the eye and assessing the optic disc, the vessels, looking for any hemorrhages or abnormalities. Again, we would assess both eyes. With her diabetes, we know that she has a risk for some changes in her eye vasculature. And what we identify in this eye is some presence of some woolly bodies within here from her diabetes. We're going to use the otoscope, and at this time we'd be inspecting more of her facial skin, as well as the outer ear and inner ear. We notice that we have nice tympanic membranes. They're pearly gray. Her cone of light is in an appropriate place. There's no redness. Again, we would assess both ears, comparing them together. We're also going to, go back to the otoscope and assess her nasal cavities, looking for any redness, drainage, swelling, masses, and we don't see anything there, and the septum is at midline. Palpate those sinuses. She didn't report any tenderness, but we'd be assessing for any in this exam, both upper and lower sinuses at this time. We also want to perform a whisper test to do a basic hearing screening by whispering. Again, we would do that both on the right and left side to verify that they both. We don't want to forget inspecting the mouth. We would be depressing the tongue, the posterior pharynx. We see tonsils there and nice pink structures. We also want to assess the tongue at all angles. That'd be lifting it up, pushing it left, pushing it right. And she's normal, but you can always assess the gag reflex to assess that cranial nerve there too. Again, moving down through the neck, we'll palpate her thyroid. Looking for any masses, having them take a drink of water and swallow helps raise that thyroid up so you can get a good feel. We notice that she doesn't have any massive nodules or goiter. At this time, also palpating in the neck region, moving downward, we're going to palpate her carotids, feeling for the strength of the pulse, hopefully noting no thrill, which we do. Again, doing bilaterally. And then at the time, since we're here, we're going to oscillate those carotids to identify any arterial sclerosis, to identify any bruits. Okay, moving downward, we are going to go to the anterior chest, continue palpating lymph nodes. These are under the armpits at this time, asking her to raise her arms. And then again, all throughout, we're inspecting the skin as we move down and through. We don't need to specifically call those out. And the anterior chest, if she didn't describe any pain, we would be at least minimally hitting 4 spots on the anterior chest wall, listening for breath sounds. Again, listening, having her speak 99, which would identify any consolidation. And that should be muffled, which it is. We're also going to palpate for tactile primitus, and those equal bilaterally. So that's a normal finding. We also want to percuss the chest, looking for any consolidation. Do that all throughout. In the essence of time, we'll move through that. While she's sitting up and we're on the anterior chest, let's listen to heart sounds and the 5 points of heart sounds. As the instructional video described, we'll just use the diaphragm portion in 5 of these points unless we hear abnormal heart sounds. And at that point, we would need to use a bell side and dig into that more deeper. She has a normal S1, S2. We don't hear any abnormal sounds, murmurs, rubs, or gallops. So move on. While she's laying flat, let's auscultate the abdominal arteries. Again, assessing for arteriosclerosis and assessing for any bruits. You want to hit all of these spots: the aorta, the renal artery, iliac crest, and the femoral artery, listening for any bruits. Again, bilaterally, back and forth comparing. And finally, while she's laying down, although she's sitting up, we will assess for her PMI. This can take a minute to do. Just feeling along the chest and noting that the PMI, you may have to have them roll on their side to get a good feel, especially in somebody who doesn't have any abnormal findings, to locate that point of maximum input, PMI. All right, so we've completed the anterior chest. We'll move to the posterior chest and complete our respiratory assessment by osculating and inspecting the skin at the time, looking for any abnormalities, moles, also inspecting for equal chest excursion at this time. Again, she doesn't have any complaints of wheezing or problems at this time, so we may only need to do 6 points of auscultation, just making sure that we get all the lobes. And again, repeating 9, and that should be muffled unless there's consolidation. This is appropriate finding. Tactile fremitus again, having her repeat 99. Again, we notice this is equal vibration bilaterally. And then while we're on the posterior, we're going to percuss all those areas back and forth bilaterally, listening for a resonant sound. And since we're on the back, we're going to go ahead and assess for flank pain related to kidney infection or abnormalities, and looking for complaints of pain or grimacing, and you're going to percuss those kidneys, and she doesn't report any, so that's excellent finding. Now we're going to lay her down and complete an abdomen assessment. While we're auscultating the abdomen, we're going to be inspecting the abdomen, looking for any masses, skin lesions, or abnormal hair growth. We see that she has some hair extending up to her umbilicus. And we want to auscultate first before palpation so we don't augment those bowel sounds. And we're going to start with light palpation, noting any pain, masses, or abnormalities at this time. And in the essence of time, we're going to move through that, but you would want to move through each of the 4 quadrants. And now we go into deep palpation, again, working your way around from starting in the right lower quadrant and moving your way around to the left lower quadrant of the abdomen. Again, with deep pressure, she had no pain and no masses palpated. Again, you want to palpate, continue palpating with the organs, feeling the liver edge. We note here it's down and we can feel it 1 centimeter below. That's a normal finding for an adult. And try to palpate the kidneys. Here we don't palpate. That again is a normal finding. And then the final place to palpate besides bilateral kidneys is the spleen, which we should not feel unless they have hepatosplenomegaly, and she does not. And then we want to percuss the abdomen as well, listening for that tympanic sound, and then also percussing the spleen, and then also percussing the liver band here. And noting the span of that liver. What I know from completing this exam is hers was within normal limits. Upper extremities, we're now going to palpate pulses and cap refill bilaterally. In my practice, I like to do these equally by feeling both pulses at the same time. This exam does not allow for that. And at this time, you'd be inspecting skin and nails, looking for any lesions or scars or abnormalities of the skin. Again, doing this bilaterally, looking for brisk cap refill on her extremities. And we note that's normal. Again, for neuro part assessment, we're going to include hand strength at this time. And one of the best things to do is have them squeeze your hands together. At the same time, assessing bilaterally strength, you should note that it's equal. We are gonna, this is also a neuro exam, having her place your hands on your knees and turn them over. This repeated speed and rhythm is a good way to assess her cerebellar function. And we see that this is smooth and easy for her to complete, and she follows directions well. We also want to assess her response to light touch and pain. Close your eyes and tell me if the touch is sharp, dull, or soft. You want to do several areas to assess. This in multiple areas using all 3 of these sensations and noting that she can identify them appropriately as to what you're using. Again, you would complete that in all areas. Assessing her finger position. Close your eyes and tell me if your finger moves up or down. Again, this is assessing for a nervous system disorder. This is something you can also do while you're assessing her skin and nails and her cap refill. We also will assess tendon reflexes. This is also part of a neurovascular exam. Here we did the bicep reflex and the brachioradial reflex. And we note that her reflexes are 2+, and we would do that bilaterally comparing both. And then we want to assess bicep strength. We want to know her arm strength as well. Curl her arms up, push her arms forward, and then shoulder strength, shrugging up, we would have her do and push against our resistance. And that's excellent. Lower extremities, we're going to inspect her legs for edema. This is part of her cerebral vascular assessment. We don't see any. We're going to palpate again. Similar to the upper extremities, we would be palpating her lower pulses. You can just do one area unless you note an abnormality. The posterior tibial pulse is a great one to do, and we note that it's 2+. All while doing this inspection of her legs, we would be looking for any skin abnormalities or changes. And then we would be assessing for cap refill, equal and bilaterally. Also the position of her toes. Close your eyes and say if your toes move up or down. Again, a neurovascular assessment. We may change. Sorry, got a little excited there. You want to do that bilaterally on both feet. This monofilament test due to her diabetes, we're looking for sensation in her feet. We know that they're prone for peripheral vascular disease. Close your eyes and tell me when you feel the touch. And on a previous assessment, we did note abnormalities in this. And as we see, she doesn't feel anything there, but she does feel it here. So that would be a finding that we would need to document and assess for in the future. Again, assessing lower dull and sharp pain similarly to the upper extremities. Deep tendon reflexes here, we're going to be checking the patellar reflex. We know that she has 2+. Again, we'll be doing that bilaterally. And the Achilles reflex. Again, doing that bilaterally and assessing for equal. And finally, down here, we want to assess strength of her knees. Push and pull again, similarly to the elbows. And then for ankle strength, we will be having her push against our hand and pull back against her hand, like as if she's pushing down on a gas pedal. And assessing her strength there. What I know from previous assessment is all this was normal. Again, all throughout, we are touching and feeling and assessing. We are assessing skin and hair and looking for any scars or anything like that.